This is Pulse 95.
Pulse 95.
It's the Morning Majlis.
It's the Morning Majlis.
Talking the stories that are shaping headlines, plus those that make you go,
Good morning, everybody. Hope you're having a fantastic Sunday, first day of the week, and we've got a lot to do and talk about on the program this morning. We've got a pretty interesting interview lined up this morning. Just after this, we'll be talking to Dr.Eman Taryam Alshamsi. She's a consultant pediatric hematologist and oncologist at Qassimi Women and Children Hospital. You're here with us in the studio. Good morning. Happy to have you to talk about sickle cell disease.
Good morning, Ahmed. Thank you for having me in Morning Majlis to talk about the Sickle Cell Day awareness.
Yes, and a lot of misconceptions to clear up as well. Incidents, how you know you have it, how prevalent it is in the region. All of those questions will be answered. So if you have any questions for Dr. Eman, be sure to text us at 4215. That is 4215. We'll be happy to relay your questions.
Yeah, so much to get through this morning indeed. So we are going to be celebrating and observing the World Sickle Cell Day, which took place on the 19th of June. And today is the 20th of June, the World Refugee Day. So His Highness Dr. Sheikh Sultan bin Mohammed Al Qassimi, the member of the Supreme Council and ruler of Sharjah, will be addressing the Sharjah International Award for Refugee Advocacy and Support. So that's happening today at 1 p.m. But we'll be discussing those plans later on the program with the Big Heart Foundation. And of course, later on the program, we'll be discussing how Sharjah is exploring opportunities of boosting ties with Guatemala. But the main conversation is all about sickle cell disease and the anemia and all the things that you need to know. And if you've got any questions and if you've got any people within your own circles that are affected by it, then do drop us those questions on 4215. That discussion is going to be up next on the Morning Majlis. But before that, some musical entertainment to kickstart your morning.
join the conversation with the Morning Majlis, Pulse 95.
Good morning and welcome back onto the Morning Majlis. We are discussing a very important topic. It is the World Sickle Cell Day, and we celebrate it and observe it on the 19th of June and every year, all about how the red blood cells tend to be unusually shaped. And now the sickle cell disease is something that some people have it, and we've heard about it. It's quite prevalent in some parts of the world as well. But the worst thing is we never know that we have it, or if we have a newborn with it. But to discuss a little bit more about this, we have Dr.Eman Taryam Alshamsi, the consultant pediatric hematologist oncologist at Qassimi Women and Children Hospital. A very good morning to you, Dr. Eman.
Good morning, Abdul Karim.
It's a pleasure to have you on air with us. Now, let's start talking about what is the sickle cell disease.
So, sickle cell disease it is a blood disorder. It is inherited blood disorder. So you get it from your family, basically. It is part of a lot of inherited blood disorder. Maybe we are hearing more about thalassemia, right? Because they are needing a transfusion, and there is a lot of center in UAE for thalassemia. So it is basically a blood disorder inherited. There is in a human being, there is a two protein chain of protein called beta chain, and this beta chain, the production of your hemoglobin. So on thalassemia, you have a lower production of beta chain, so you'll have thalassemia. And sickle cell disease and other shaped, let us say shaped RBC, we have abnormal beta chain. So basically it is the red blood cell, it is like biconcave. Maybe we can see the picture here. It is a biconcave cell, and then when it is exposed to certain environmental things like extreme hot, extreme cold, dehydration, it can go to sickling. So it is basically like a crescent shape, or can we say it is like sickling, or so this is basically the shape. It is like hilal shape, right? So the normal RBC with the round things, it goes smoothly through your blood vessel. It's carry their oxygen to the tissue and goes smoothly. When it is sickling, it is impaired. It is function, and then go and stuck on the small vessel. And stucking on the small vessel, it will cause the symptoms basically. So it will decrease the blood perfusion. So the blood will go less in your tissue, and then you will have the symptoms.
Can you talk to us more about those symptoms? What problems does sickle cell disease give you?
Yeah, so it's depend where this cell stuck. So you can have it anywhere in the body. The commonest things actually, they came with pain crisis. So they come with a pain, muscle and joint, abdominal pain, and the tummy, headache. So it can have pain anywhere in the body. It can be mild. So parents usually they can manage it at home. So they give a lot of fluid to rehydrate the cell, and then they give painkiller like paracetamol or Panadol and Brufen. It can be more severe, so they cannot manage it at home, and then they will bring the child to the emergency room, and then they will get more stronger painkiller. So this is one of the commonest symptoms. Other symptoms, if it is stuck on the lung, so on your chest, so you will have a respiratory symptoms. So your breathing will be very fast. You will have a chest pain. Your oxygen will go down, and definitely you will need to be admitted to the hospital. Another serious, not common, but serious symptoms if it is stuck on the vessel in the brain. So you can have a stroke. So basically you can come with a headache, blurred vision, you can have weakness, inability to talk, inability to walk, like stroke symptoms, and then ended by the emergency room, and then you will require admission and further treatment.
So this is something that manifests itself from a young age, and health professionals can easily diagnose it after you go to the hospital with symptoms?
Actually, in a lot of countries, newborn screening started. In UAE, it was started in 1995 as universal screen, and then it was expanded in 2002 as national program. So it started initially with a specific genetic diseases, endocrine diseases, something called metabolic diseases, and then they add the hemoglobinopathy with include the sickle cell and thalassemia things. So it was added actually in 2002. And since 2002, we are having a report from the National Newborn Screen, and they add also something called G6PD, which is another blood disorder. So basically, we get a lot of report through the Ministry of Health. It is very simple test. So any newborn will have a heel prick. So few drops from his heel, put on a filter paper, and then sent to the Ministry of Health to do the testing. And then within the first week of life, they will get the report and redistribute it to the hospital, original hospital. And then you call the parent, and you start counseling.
Oh, okay.
So, Dr. Eman, what kind of cases have you seen in the United Arab Emirates? Because now, obviously, with a lot of people who are not aware of this disease will have alarm bells in their heads and thinking, is it me? Is it my child? Is it in terms of the people appearing to see you, where are they ethnically from in their background, and what kind of cases do we see at the moment?
Okay, so let me show you this map of the world. It is basically in Mediterranean area, an African belt we call it. With the more dark red, you can see it is more prevalent. As you go lighter, it is less.
We're just talking about this off the air too. Why this region in particular? Why the prevalence of sickle cell disease in that region specifically? And you pointed out that it has something to do with malaria.
Yeah, so it's called malaria belt. So basically, subhanallah, the shape of the cell. So malaria basically it's invade the body and live on the red blood cell. So because of the shape abnormal shape of the cell, malaria hate to go inside. So it is actually a prevention for malaria. So any African human being there having sickle cell disease, actually it is protecting him from having malaria. So this is one of the theory why it is distributed on this area.
Wow.
Yeah, if you have sickle cell traits or sickle cell disease, is it something you should be worried about in terms of the prospects for having a long, healthy life? Should you panic about it? Is it something that people should, or is it manageable?
It is manageable. I'll tell you, it is a lot of a new advantage nowadays. So on the area of no antibiotic, so basically a sickle cell disease can go and stuck on your spleen, and the spleen, it is an organ that protects you actually against infection. So in the area without antibiotic, the mortality towards a death was high. With introducing the antibiotic, so basically with a newborn screen, we know the child he is having sickle cell early in life. We call them, we start actually a prophylaxis antibiotic at 2 months of age. So before the spleen lose their function. And then again, with the era of vaccination, we get a lot of advance on their age. So basically, we call them, we add to the regular schedule more vaccination, which is specifically for the sickle cell. There is a regular follow-up for them. So you screen them to prevent any, to diagnose and prevent any complication of the sickle cell. So you interfere immediately and early, and that will extend their life further. Another things, introducing one of the drugs called hydroxyurea. It is one of the drugs it is like a miracle for sickle cell, because it is basically increase something called hemoglobin F and reduce the sickling. So basically, these children who is on hydroxyurea, they are coming less to the hospital, and they will have a lot of less complication compared to the children without hydroxyurea. It is a long-standing history of this drug. It was just the initial worry about it because it was labeled under chemotherapy. So people, they are afraid of chemotherapy and the complication of chemotherapy. But with time, people, they start to know the benefit, and there is no risk in terms of cancer things. So many children nowadays, it is on regular hydroxyurea, and they are having less attack of complication of sickle cell disease.
And how can we prevent it? Is it something that before a couple gets together that you sort of do a scanning, or is it something that you continuously monitor certain groups and say, because they originate from this part of the world, we'll do specific tests on this child which is born, or even the adults?
So basically, there is a premarital screen. I believe it is on many countries now, and it is already on UAE since long time. So when you get to before marriage, you need to go and do a blood test, including other tests like viral tests. And one of the tests, including, it is called electrophoresis, which will test you for any blood disorder. Okay, so you will have the test saying you are healthy or you are carrier of sickle cell, thalassemia or other, because eventually if you are having the disease, you will have the symptoms, right?
True.
But if you are sickle trait or carrier, you will be like a silent carrier, so you will not have anything. So this is basically a reveal that you have a carrier state. Let me show you how it is. And usually they refer it to the hematology for counseling, and then we'll tell you exactly your risk during what is your percentage to have a child affected by sickle cell.
So if I have the trait and my partner does not have the trait, how likely is if you have
So
that?
you give me this scenario, and I will go and draw the scenario for you. Okay. So basically, imagine, Ahmed, this is your wife.
Yes.
So she is healthy. So she have hemoglobin A and A. It is not the blood grouping. It is just it is called hemoglobin A, and the electrophoresis. So basically, she have two A and A, and you are A, but you didn't know you are carrier for sickle, right?
Yes.
So in each pregnancy, you have a percentage of risk. It is not like in this pregnancy you will have it, and next baby it will be affected. So each pregnancy you will have the same percentage of risk. So let us go. So basically, you will get one from the child will get one from your wife, so A, and one from you. So this is another A,
Yeah.
and then the A and S. So this is a carrier, right? And then this A from your wife, and this A from you, and then this A from you, from your wife,
Yes.
and this is your S. So basically, on this, if you are carrier and your wife is healthy, you will have a 50% chance to have a trait. So carrier, right? And then you will have another 50% of a healthy child.
So 50% chance of the child being a carrier, but not necessarily having the disease.
Yeah, because you are carrier and your wife is.
So both people have to be carriers of the trait for the child to have the disease.
Yeah. So let us do this.
That's interesting. And if you're just listening, Dr. Eman's actually drawing this out, every single scenario. This is very fascinating.
Okay. So this is your wife.
Yes.
Okay. So this is an S. So this is basically a trait and a trait, right? So if you have trait and a trait, this is your A and A. So this is a healthy child, right? And then you have this A and you have this S. So this
Carrier.
is a carrier,
Yeah.
right? And then you have another S here and you have an A from here. So this is another carrier, right?
Yes.
And then so this is A. I miss it, right?
I think it's SS, the last scenario.
Last scenario it will be SS.
That's the
You are
disease.
right. See, you get it now.
Yeah, I feel like I'm in school. This is amazing.
So this is an SS. So basically, you have 25%.
Yeah.
This is a disease one, and then you have a carrier state of 50%. Okay, and then 25% healthy. So people, they get it wrong because they said we'll try our chance. So if we get a disease, maybe we'll get pregnant again, and then we'll have the 25. So basically, it is each time you have the same risk. So sometimes all the family it will be affected. So you should not play
Yeah.
on this. So what is the solution? If you have more S, actually, you will have more of the red, right? And if you have beta thalassemia, if you have hemoglobin D, hemoglobin S, name it, any abnormal hemoglobin, and put it instead of the S, you will have also a disease. So basically, it is a big, wide spectrum of disease. So you can have a hemoglobin SS, which is the sickle cell pure, or you can have sickle cell with beta thalassemia, which is again a disease. You can have sickle cell with hemoglobin D, and again it is disease. And so any two combined abnormal hemoglobins give you a disease. So you need to be careful. So your partner should be totally AA.
Yeah,
Okay.
yeah.
So they actually asked me what is the solution for this.
Yeah.
So first of all, if you are not married, it is easy. So you decide you want to go through this. You want to go through a child who will be having a disease. He will have a frequent admission, frequent clinic visit. He will be in medication or no. So you decide if you want to proceed with this marriage or no. If you are already married or you want to proceed actually for marriage, there's a solution. So basically, we ask them to do genetic testing, and then they go and do IVF.
What's IVF?
Let me invert.
What does that do?
Yeah, it's basically when the couple they cannot get when the woman she cannot get pregnant.
Oh, yes. Yeah.
So they will go to the gynecology, and what she do, she took the sperm from the man and the ovum from the woman, and then just they do it outside the body.
Yes.
So they do it outside the body, and they get the fetus outside the body, and then they put it back to the woman tummy. So basically, you can test the baby, right? So before putting back the baby, you can test it, and if it is not affected, they can proceed with this pregnancy. If it is carrier, most of the time they proceed with this pregnancy. If it is affected, they will not put it back to the woman. So this is one of the way you can actually have a risk of having a child with sickle, but you try to eliminate this risk.
And Dr. Eman, how common is this trait for sickle cell? If you have any data on that.
Yeah. So actually, I was searching yesterday because our area they have less reporting. But actually, I found a report actually for the newborn screen. It was published in 2014, and this is like a report from UAE actually, and they report a prevalent of this trait of 1%. And the prevalent of sickle cell disease on the newborn screen 0.04. And actually it is like comparable to the other Gulf area with a higher on the Eastern and Bahrain. So you have 2.1 and of the disease and the carrier. So it is higher on Bahrain and Saudi Arabia. It's almost the same percentage. But imagine this is like on 1 year or and this keep accumulating. So if you have accumulative case and you don't know and you get married, you will have more cases of sickle cell disease.
And more on what you do specifically, let's say my child has sickle cell disease. How important is it for me to take my child to a clinical hematologist like yourself?
Okay. Usually they assign you from the newborn screen. So when they do the newborn screen, they refer it. So they refer to hematology. So you'll have your initial counseling. And then we will schedule you on a follow-up with a hematologist. It is straightforward, a follow-up, where you need to visit every 2 to 3 months. It depends how much your education. A lot of family, they are very good on this. So from first and second visit, they get all the information and they start managing the children at home. So basically, if the child, he's doing fine, mother, she know what to do in terms of if he's having fever, if he is having any pain crisis. So she know what medication she should do, what about the hydration. She can give him some massage for the pain. So she know all the information. Sometimes we space their follow-up every 3 months. If they are not that, they have a lot of crisis, we usually like to see them every month to make sure there is no complication from the sickle cell.
Amazing. Well, Dr. Eman, I'd like to get your final thoughts on this in terms of alleviating the concerns for the parents that there is treatment. And what should they know, and what should there be a final message from your side to them when they come up with such a case?
So sickle cell disease, it is here in UAE and everywhere in the world. There is actually a good program for prevention complication, for dealing with this disease, and their life expectancy has become as normal individual almost. And there is actually a cure. So a lot of parents, they ask for bone marrow transplant. So bone marrow transplant, it's one of the things can cure your sickle cell. So if your child have a bone marrow transplant, he will become a normal individual, right? Carrying the disease, but not having any symptoms of the disease. And there is a lot of advanced innovation and medicine going with a gene therapy for sickle cell disease, and hopefully soon we'll have the gene therapy, and it will be something, it is not only prevention and treating of the sickle cell complication, it is actually treating sickle, so you will become normal as any other individual.
And is the treatment very costly? Is it usually covered by insurances, or what's the scenario?
So far, it is depend on the area. Most of the some, not most, some of hospital here in UAE actually it is free of charge.
Oh, okay.
Like Health Authority in Abu Dhabi. Here in Sharjah we cover some, and the insurance actually cover.
Okay.
So insurance actually it is covering sickle cell disease. So who is having insurance will be covered, and most of the time other children who is not having insurance, also the hospital is trying to cover all these expenses.
Well, wonderful to take back, and just some concerns if they might have been raised and some alarms, then this should have alleviated those little concerns this morning. Well, thank you very much to Dr. Eman for joining us this morning. It was a pleasure speaking to you as well.
Thank you, Abdul Kareem. Thank you, Ahmed. It was my pleasure to be with you. Thank you.
Well, you're listening to the Morning Majlis, so we are going to continue with our discussions. This was our conversation with Dr.Eman Taryam Alshamsi, the consultant pediatric hematologist oncologist at Qassimi Women and Children's Hospital. If you'd like to catch this discussion as a bit of a podcast, you can do so on Spotify, Apple Podcast, and even SoundCloud. Just search for the Morning Majlis. This should be going up very, very shortly after the show. Well, stay with us on the Morning Majlis. Restrictions on the world of travel up next.
If you liked this episode of the Morning Majlis, drop a like and subscribe.
95.
Be sure to follow us on Instagram for all our daily updates and top stories.
Pulse